Are you listening? Damn.
Morning, guys. Looking the same. They didn't wash my hair yesterday, so today they'll wash it and brush it and I'll look a little different. But it is Monday the 16th. I still have my pain pump in my arm. They'll take that out, I guess, whenever. Since I did have the lift and the implants, they have to be super careful about my areolas. So yesterday I got in my faja and my compression bra, but I was pretty worried about how tight the bra was on my areolas. And I probably mentioned it before, but you just don't want to cut off the blood supply. You don't want to put any pressure on the blood supply to the nipples. And they've been looking fine. So they text the doctor, and I can't remember her name. She's a lady who comes to the hotel. She didn't come see me yesterday. She said she was going to, but she didn't, but I'm fine. So they text her and she said, yeah, just take the bra off her and just wrap her up like she has been. So I'm just wrapped up in some gauze and some tape. It makes me feel much better. So just speak up if you're feeling worried about something. Most of the nurses that have came in here can speak English fine. One yesterday was just a little bit limited when I was trying to say tight. I was trying to use my translation app. My dad was trying to, we couldn't find the word. And so she had a phone that I could talk into and it would turn it to Spanish for her. And then she could talk into it and turn to English for me, but we still just couldn't. She thought it felt too tight. It didn't feel tight, it felt fine. I just was worried about how tight it should be on my areolas. So she called the valet Alex up here, and my dad's down at the cafeteria in the hotel. It opens at 7, and so he brings me up my breakfast from the buffet, and then he'll get me my coffee too, which has to be decaf. So he'll get my coffee, and I brought my protein in this big old mug that I can, if it all fits in, my protein and my coffee, and I've cooked some oatmeal in there too. Anyways, so she had to call the valet up, Alex, and she can speak Spanish and English, so she was better able to understand that I was worried about it being too tight, and she contacted the doctor. Every 4 hours, they heat this up. It's just a rag in a bag, and it sits on my chest for 10 minutes just to encourage a lot of blood flow to that area. And then my hands and my knees are the worst, are just really swollen for whatever reason. You know, they call it swell hell. So they also heat a glove up like this and they put it on my hands. They're really good about that at the hotel. The hospital, they were not. The doctor would come in and say, oh, they need to get heat on there, I'll tell them, and then they would never happen. So we're just gonna forget about the hospital part of it. Thinking about having to go back there, I'm excited to see like Dr. Galvez and Dr. Sanchez for my follow-up, but guys, that hospital, I don't know, it wasn't good to me, and it wasn't welcoming in the room. It was really like a jail cell, and the people just weren't as friendly. So if you have great service there and you love it, great, but just, I was not prepared for the difference between the hospital and the hotel. The hotel just makes you feel 100 times better. The people treat me better. I really like it here. I'm happy here. I feel good here. But my minimal Spanish, you know, I had basic Spanish classes in like junior high, high school. I even took a couple in college. And in between, I've just like downloaded apps on my phone. Even before I planned any of this, I would listen to basic words in my car as I was driving. And so for some reason, a nurse at the hospital didn't know what the word water was. So I was like, I need some water. And she was just really confused. And so then I was able to say agua, and she knew what that meant. So I thought you were gonna hang out down there and have some coffee.
I'll be in. Just for you.
Okay. Just small work like that have helped me. And the TVs here, so at the hospital, the TV, there was like a couple English speaking TV shows, pretty much just movies. And then at the hotel, you can watch anything in English or Spanish. So you can turn the channel. I know other people have brought like their Fire Stick and can watch Netflix. And you can also get on Netflix if you have like your sign-in information. But I don't think my dad knows his stuff, his sign-in stuff. So we just find news or movies that we want to watch here on the TV, and they showed us how to change it to English, and it's all good. He just brought me up my breakfast. It was pancakes and eggs. That's just what sounded good today. Or this morning, I had ham and eggs yesterday, and the ham was weird. I couldn't eat it. I took a bite of it, and it wasn't good. So the eggs are basically for protein, and then I'll have a few bites of pancakes just for pleasure. But I really haven't. Today is the first day I've actually been hungry for food. I just kind of have to force myself to eat when they bring me food in the hospital and here, just because I know my body needed it, but I didn't really feel hungry. And when I did eat, I could hardly eat anything. That's still the case. Just I get full really fast. I think that's common after surgery. I had my first bowel movement on Saturday. No problem, and I was able to figure out how to wipe myself, which was a big concern of mine. It's not the most ideal situation, but I got it done, and I pooped, so that's good. They're still giving me stool softeners just in case. Every time that they come into the hotel, they have to fill out this sheet that says who was here, what time they came, my vitals, and like medication. And there's a bag of medication they give me, which is like if I want pain pills, which I have not taken. My back's been a little uncomfortable, but usually I can eventually get to a spot that works with the pillows in the bed, and I like sitting up on the couch so my back's not leaning up against things. Muscle relaxers, antacids, antibiotics, and stool softeners. And I think there's some blood thinner shots, but they said they have to wait for the doctor to decide on that. So I don't know if everyone has to take those or what. I don't know if they're going to be painful. They probably are. I'm not looking forward to that. I'm not looking forward to being stuck anymore. Keeping my arms out away from, so my armpit doesn't rub. My left arm has way more mobility than my right arm. So I do pretty much everything with my left arm and just take it easy on my right arm, try to bring it a little closer every day, but like I can get my left arm to my mouth. I'm too scared to try to get my right arm to my mouth right now. So I use my left hand pretty much for everything, but I wipe with my right hand. TMI maybe, but good to know. I really have only worn one outfit, and that was just to get from the hotel to the hospital to the hotel. And then it's just been, that was like a zip up dress, and then just this robe around, pretty much covered. And even though this faja is open in the crotch area, the bags cover that. And then I have a robe on just because my dad's here and don't want him to see any of that. I think that's pretty much it. I'll probably get another shower today. I think they shower you every day. They do really good about blow drying here. She spent lots of time blow drying me, putting spray on me, making sure everything was wrapped properly and that I was comfortable. They just do a really good job here. So the plan is today, get my hair washed, get it brushed. They're not real big on like brushing your teeth or washing your face. So my dad has been washing my face for me and helping me brush my teeth. It's fine. He's fine with it. I'm fine with it. But just know that's not anything they've really offered. And so I'm going to get ready to take my morning meds, my multivitamin, my biotin, and my collagen, and I'll eat my food. The doctor, when he was marking me up, he said, I really want you to take a vitamin C. I already do. So he was happy with that. So just be prepared for that. I have some just chewable tablets. And he's like, and get your protein in. And obviously with being a weight loss patient, that's your main focus a lot of the time. So we're good on that. So I'm going to eat my food and 30 minutes later, drink my coffee and continue to stay hydrated with my water. I've just been going hard on the water. I don't want to have any problems with dehydration, nothing to keep me here longer. We are ready to, even though it makes me nervous, to go take care of this stuff by myself. Not really by myself, someone else is gonna have to take care of it, obviously. And I don't want I'm not excited for the plane ride home, but even though it's nice here, we're ready to get home and see all the people we love. So that is the update for now. So this is the bathroom. This is what it looks like when you walk into our hotel room. Everything's a mess because I just tried to get everything out and I can't pick it up. We got a microwave, a couch, a little chair I like to sit in with a pillow, my bed, the TV over here. There's a little mini fridge here. A closet here, my dad's bed, our little table in between us, and a window, and that's where our luggage is. It's nice and it's comfy here. Don't mind the pads in my hair. This is just what we look like this afternoon. They came in, Anna came in and gave me a massage. She massaged the lower part of my back and my stomach. The back felt good. The stomach was weird at first. And my stomach is, bless you. And my stomach is kind of numb, so it was just weird. And she was like pushing a lot, but then she eventually rubbed and it felt good. Then they came in and gave me a shower. And they put me in my faja and my compression bra, and I did have the strap over the top, but because I had such a drastic lift plus implants, all right, that's 4 times, that's enough. Since I had such a drastic lift and implants, Dr. Sanchez said it's super important for me not to have like a ton of pressure on my areolas. So I was kind of worried about that. So they asked the doctor, I can't remember her name. She's a lady that will come around to the hotel. And she said, yeah, just wrap her. So they took off the bra for now and I'm just wrapped. And I have my little, that's what I look like right now. My knees are swollen, like they look like the size they were before I ever lost any weight, and my hands also. Everything is just super swollen. I know it'll eventually go down, and compression will help, but that's where we're at with that today. It's about 3:15, no, I think it's almost 4 this afternoon, so 6 where I'm from. And we will have dinner and they'll keep coming in and checking my vitals, and that will be the excitement for today.
You're leaving tomorrow, right?
Yes.
Where are you coming from?
Kansas. Missouri /
Kansas City Chiefs.
Yep. He's not a fan, you better not let him hear you say that. But yeah, that's where we fly into, is Kansas City. Always making sure to help me stay hydrated. and he puts it in a smaller bottle so I'm not lifting heavy things. She came in to give me my antibiotic.
Muscle relax.
Muscle relaxer. It's about 9 p.m.
And just hold soft now. Okay, I'm gonna give you
Yes,
soap.
thank goodness.
Alright. (110/70). Your saturation it's 99. Your oxygen and your pulse 76. Checking your claims and your tampon. Okay.
Mm-hmm. And she just took my pain pump out, which I'm happy about. It's all gone, and it was bothering my arm a little bit, so it is out. Morning, it is Tuesday, about 7:30 a.m. We get ready to leave tomorrow, so I'm just making sure everything is done around here. So part of this tipping and thank you notes. So I brought some thank you notes, and since they have this list of all these nurses that have came and helped me, I will write out thank you notes and I will leave tips when I leave. So I don't tip every time they come in. I'll just give them a tip at the end when I'm getting ready to go in their thank you note. I also will add in Mama Galvez for her meals, and Anna gave me my massage. I don't know if I get a massage today and if it will be Anna again, but if not, whoever that is, they'll also get one too. When you look on like a Facebook for Dr. Galvez, people are pretty all over the place when it comes to tipping. So that'll just be up to you whether you want to do it so many dollars a day or if just you want to give her overall lump sum, but you do want to make sure to bring some $1 for the drivers or anybody you think has helped you out. And also on here is like the valet. So Isis and Alex, they'll be added in here too. I haven't had them do much for me. They just bring up my food. So just based on how, for me, it's going to be based on who I've seen the most, who's done the most for me, and just kind of go down from there. So if that's something that you haven't thought about or something you want to do, just remember your thank you notes and remember to bring smaller denominations of US money to be able to leave for them.